everyone knows when something's going on with them. Just because your child does not talk or your child is having difficulty talking does not mean they don't understand that you're disappointed as well. And sometimes it can be taken into context of them thinking that the parent is disappointed in them as opposed to being disappointed in the situation.
Hi, Jessica. Welcome to the Authentic SLP. We're so glad you're here.
Thank you.
So I wanted to start off and just ask you, just tell me a little bit about yourself and how you became an SLP and what inspired you to start Tweet Like a Bird.
Okay, I've been an SLP for 13 years. I received my bachelor's and my master's from the University of Central Florida. I've known I wanted to be a speech pathologist since sixth grade. I'm a military brat. My father was in the Coast Guard, and in sixth grade, I was stationed in Kodiak Island, Alaska. Very, very tiny, tiny island. And in my class at my school, there was only about 10 of us. There was a little boy. Well, he wasn't little. He was in sixth grade as well, with on the autism spectrum. And I remember his aide would give him index cards with questions to go around on the playground and ask people. So that was really cute. And for some reason, he'd always come and ask me first. So his aide and my teacher told my mom, she really has a gift. Nick really loves her a lot. This could be something that she could be very good with. So believe it or not, I established that was what I wanted to be, even though I had my short phase in high school where, I wanted to be an actress because that's just fabulous. But other than that, I stayed with the SLP thing. I decided to build my business, Tweet Like a Bird, because I have young children. They're 5.5 and 7.5, and I just wanted more time with my kids. In a lot of settings, no matter what setting you are in, speech therapy wise, it's really hard to be a mom and do your job. So to balance all of it out, when I have my own business, I can make my schedule. I can, I'm really excited because this is the first time I'm going to get to volunteer at my kids' schools and go on field trips. So it's really nice. Also, when my kids are sick, I can stay home. It's a little more difficult if I were to work elsewhere.
Yeah, I read somewhere that if you have a job that lets you attend your children's field trips and volunteer like you won at life. So this is kind of like what you're doing, right? You're getting to win at life.
Yep.
Your job and this. And that's funny because I actually knew I wanted to be a speech therapist when I was like in third grade.
No way.
Yeah, but there's not a lot of people like that. But yeah, that's so funny. Young age. And then I was in special needs groups because I had trouble saying all my sounds. And so then I developed connections with kids that way. So that's interesting. Yep. That's cool that you were in Alaska though. You said that you're fun and bubbly. How does your personality shape your therapy sessions and your connection with families?
Well, let's think about it. The kids that need speech therapy, whether they're nonverbal or verbal, they know something's going on with them. They're all really smart. And the thing is that they know why they need speech therapy. And I don't want them to go in, and I want speech therapy to be something they look forward to, a celebration, something fun, someone to look forward to. I have an insane amount of toys. You should see my house. My husband makes me get rid of them more and more every day, which is sad because, I love having my own Toys R Us. But on the other end, I got to keep my therapy stuff for my patients, which I completely lost my train of thought, Nicole.
It's okay. So we can edit that out. It's no big deal. So you're fun.
Let's edit that. I have ADHD as well.
Me,
So,
I know. I follow you completely. So
okay.
you're fun
Okay,
and
where
bubbly because these kids, when they come in, they know they need speech therapy, and you have to be fun and bubbly because
yeah, these kids know that they need speech therapy. They know they need help. And I want them to view speech therapy as something fun. I want them to be excited when they see me. I want them to anticipate all the cool stuff that I have planned for them, as opposed to thinking of it as a place where they're consistently told something is wrong with them. Plus, I really like people. I really like conversation. One of my favorite things about being able to work more closely with families in my own business environment, I can just get to know them. Um, Use my bubbly personality to. It's easier for people to open up to when you appear to be more fun and bubbly.
yeah, definitely we don't want the kids to not like speech therapy or what, speech therapy is such a broad term, right? All these kids are so
Right,
different things that you can do. And
right.
speaking of that, I didn't put this in here exactly, but I guess we did. So some of the areas that you specialize in, like what kind of if like you were like, I love seeing this type of child. Not that you don't love seeing all kinds of kids, but
Right.
what are some of that you're like, I just connect with these kids really well, and this is just something that I really like. What would that be?
I
You can
love.
name more than one thing, but just
Oh, okay. I love I love articulation. Articulation, people think speech therapy automatically it's articulation anyway, because no one thinks speech language pathologist. There's always the speech in there. I mean, think of it. It's a really long name. I mean, I don't use speech language pathologist either.
I know, and I
But
hate it when people are always like, "Are you a speech language pathologist?" I'm like, "Well, yes, it's all the same thing." Like people don't know the difference, but yeah.
the difference, yeah. I like language. I mean, it's so great to get my itty bitties or even my older kids that are nonverbal all of a sudden to start talking, which I love that, watching them grow, etc. So the language aspect is great. Artic is good. Um, Prompt, I'm certified in prompt.
You're
That
certified?
yes.
Like gone through all the levels before certification?
Well, the introduction. So certified via introduction training, I would
You're
say.
trained, the first level.
Trained.
I
Trained, not certified. I am sorry.
Sorry, I am certified, and I'm gonna
You're certified.
and I spent lots of money, so
I
gonna
believe
call you
it.
out on that one because it's a big difference.
How much money does it cost?
At the end, I probably spent over $5,000 to be
Oh
proper.
my goodness.
So yeah,
It's fascinating though, isn't it?
I love prompt. I'm prompt trained, so I'm prompt certified. But I went the training class, the bridging across
Right.
the practicum, and then the certification with a mentor. And I had to like write a whole dissertation on it. And you know what's cool though? I do love prompt, but I wish I would have understood oral motor therapy
Yeah.
before that.
Yeah.
Um, but yeah, it's fascinating, and it definitely goes with the oral motor, oral facial, everything together, and articulation together. So yeah, no, I do love it. It's a good course.
Yeah, it's good. It's fun too. It's really cool because it works. I've
Yeah.
seen yes, it's so simple, but yet it works. It's fabulous. Today I was working with a little girl that just R's. R's is the dreaded phoneme
Yeah.
for a poor child and for speech pathologists. You see R on the eval or on the referral, and you're like, oh, this is gonna be fun. So, but I used prompt with her today, and it was amazing. She
Perfect.
she got it. So I love prompt. I am trained in sequential oral sensory approach to feeding. So I provide feeding therapy. Now, one of the things that parents get a little confused about is I'm sensory feeding. I don't do like latching, lactation, bottle feeding, transition. I'm a sensory feeding therapist. A lot of times when people say I give feeding therapy, then they don't specify what they're specialized in. And so I give the sensory.
Well, that's really good to know because that's kind of the reason I'm doing this too to figure out what kind of patients are good for you in the area. And if
Yeah,
you're looking for a lactation, that's not you. If you're
right.
looking for a child that maybe is a picky eater,
That's me.
I have not taken that course, but I've heard such great things about it. So, I'm from what I know, because I've had a few therapists that have gone, it's a lot of ruling out medical too first, right? Is it behavior? Is it sensory? Or is there something? And that's how we all agree on.
Agree with. Um, the thing with the SOS approach too, on SOS approach usually ends at about 5 years old. They recommend it's most successful from 1 year old to 5 years old. But in actuality, I've had a lot of success with older kids too, which I've been very surprised. I have an 11-year-old little boy right now. He's not little. He's taller than me, but everyone's taller than me. That I treat, and he's actually been very successful as well. But I'm really strict.
Oh,
That's another thing is I like that I can tell my parents ahead of time when we have consults, listen, I'm very strict. I don't take no for an answer. I'm strict with the child and I'm strict with the parent because when I give feeding therapy, I also provide homework for the parents and the child.
yeah.
And I do. I say I'm I'm gonna avoid therapy altogether, and we're gonna end therapy if I don't see homework,
Good for you,
fulfillment,
Jessica.
progress. Yeah, well, because if I worked in other places that I will admit, I have been spoken to because the child gets upset with me and then they go running to mommy and then I get in trouble because mom complains. Whereas this way, I can warn people ahead of time and do it the way I want to do it.
And set the expectations up front. And I love that though,
Right.
Jessica, because I am terrible at that. Okay. But sometimes parents want different things. So sometimes parents want more strict, and some people want more like more child led. So that's just it's just two different ways of parenting and two different perspectives and two different children. Well,
Yep.
more than two different, but that approach does work. So that's good to know. When there's a parent that wants someone that has more structure and is going to hold them accountable, then you're the person to go to. So that's great.
Mm-hmm.
You are correct about SOS feeding and feeding. If you do not follow through,
Mm-mm. No, you
I
do
am
not.
a mom of a sensory feeder, two of them, and it's very easy to get stuck in the same foods. You know they'll eat that brand of pizza. You just keep buying that brand of pizza. I get
Well,
it.
when you're tired too, do you really have time to sit there and argue with your child? I understand. I get it. You
Yes.
know, whereas so then I come in and I implement, okay, this is the homework. We have to do the homework. You have to do it. And it actually works out fairly well because I'm in with the family 1 or 2 times a week. The child is with you all or parents or grandparents or guardians all the time.
Yeah, it's true. They have to follow through, and everybody has to be on the same page that's with the child. So
Hmm.
that's awesome. Any other areas that you just really love, or you're trained in, or you feel like you're kind of an expert in?
Um, I really love prompt. I really love sensory feeding. I love it all. Um,
If you could take one course right now, what would
yeah,
it
myofascial.
be? Okay. Yeah.
Yeah,
Myofascial or myofunctional?
myofascial.
Function.
Myofunctional.
Okay. Like oral facial.
Excuse me. For a speech therapist, I can't talk. Myofunctional, not myofascial.
Well, there is too, and I've thought about
Yes.
taking the myofascial. Like, it's
Facial.
what's
Is
in
it
our
myofascial or myofascial?
I don't know. See, I don't know either. But that's like a massage therapist. So, but they
Yes, no.
some speech therapists
Myofunctional.
do it because you do. There could be some ties. I don't know. I just took a Beckman's course is really good. She has a deep tissue course,
Yeah.
which is really good, and it does like release. And I kind of feel like I should take an actual course on release before I'm doing it. So,
That makes me so, you know what? I'm so upset because COVID. I used to love going to these in-person trainings, and then now all of a sudden there's hardly any. Like right now, I'm taking a training on Kaufman approach to apraxia. Um, it's fabulous, but it's not nearly as good as it could be if I were in person.
yeah.
Because if I have to do it on the computer, how many days is it going to take me?
Yeah. Yeah. No,
Yeah,
me too. And I just can't focus. I'm definitely an in-person person. Well, you said you're a people person, so you like
I'm in people. Yeah.
me
Hmm.
too. Yep. But myofunctional therapy, I just took that a few years ago and it completely changed my practice. But
Really?
mm,
Well, there's also a lot of people that have been asking for myofunctional therapy lately as well. Like when people are asking for therapists, recommendations, there a lot of them are asking for specific therapists who have training in myofunctional.
yeah. Yeah, it's still a
Hmm.
cool thing. I mean, I'm glad I've learned, but I kind of, my thought is always it's fun to learn these new techniques. But if one technique is your only practice, like if your whole practice is on one thing, it's probably not a good idea. I like to learn a little bit from everything so you have lots of tools in your pocket.
Hmm.
A tool in my pocket. I wouldn't say it's my entire practice, but it's definitely a tool in my pocket. So
Yeah.
it's fun. And I know I'm fortunate to been able to go to a few. So yeah. And what about like um, fluency, literacy, any of those things that you like, older kids, younger kids?
Well, you know what? And I contacted a woman who does testing, neuropsych testing for like dyslexia and dysgraphia and stuff. And she asked me if I was certified in like Linda Mood Bell and stuff like that. And I never really thought about that either. She was looking for a lot of parents who have those diagnoses for their kids are looking for therapists also that are specialized in that sort of stuff. So I guess that's another training, but I don't like doing online courses. I love to learn. I love it. But really, I don't feel like sitting on my computer learning.
Agreed. Agreed. Yeah.
Hmm.
There's so many courses you can take. And the Linda Mood Bell, I mean, I haven't taken the reading course, but it's all interesting. And there's so many things you can, specialize as a speech therapist. You want to do everything. Sometimes it's nice just to
Right.
kind of have a niche too. Um,
Right.
but yeah, the literacy thing is, yeah, it's not something I do. So I was curious.
No, it's not. I'm guessing there aren't very many speech therapists that do it because that was the first thing she asked was do I do that.
Yeah.
But I guess you asked me what do I like have least experience in? If that was kind of one of the things you were asking, it'd probably be literacy.
Okay.
I mean, I can totally, assist with reading or assist with, phonological awareness, etc.
Mhm.
But a child with dyslexia, I really can't.
Yeah. Yeah. I think
Mhm.
that's a multidisciplinary approach, anyways.
Yeah.
So
Hmm.
I think we know part of the puzzle for that, anyways. So.
Hmm.
Um, so you said that you make yourself available to parents outside of therapy, which
Yeah.
isn't something every practice offers. Why is that so important to you?
So with Tweet Like a Bird, I'm coming into these families safe place. I feel like the child is the centerpiece, and once the therapist and the family come together, we're all there for the same reason. And if a parent needs my help for something, please contact me. Text me first. Text me first. Because the amount of solicitors now, I don't answer my phone anymore. But they contact me specifically, mainly my feeding parents. They because if they're at dinner and they need some assistance, you better believe you can call Miss Jessica and I will help you out with that. I had a little boy who wouldn't eat his food a couple weeks ago, and mom told him, I will call Miss Jessica right now. And he was 3 years old, and she called me on the phone and she said, blah, 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 isn't eating his, I forget what it was. And you hear him in the background, no, 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 you actually called her. Told you I'm very strict.
No, that's good. That's great. Like I said, I had a patient once, same thing. I think they came to my feeding therapy, or I think that was maybe ABA. I don't know, but they were like, "We're gonna call Miss Christie and tell him that you're not doing this." Not, and like the kid like listened all of a sudden. So I was like, "Oh, whatever, whoever Miss Christie is, yes, call
Yeah.
her because it's that person. That's great. Whatever works."
Whatever works, yeah.
So funny. But yeah, that's good to be available. We don't do that, like, because we are a bigger clinic, so it's hard to get to offer that
Yep.
individual service. Question. So you
Yeah.
have a child, a parent, and their child receives a diagnosis they weren't expecting.
Yeah.
Advice would you give to that parent when they just kind of feel overwhelmed or they know the early, maybe around 2 or 3? What would you give that advice to that parent?
Well, first of all, I think it helps too that I'm a mom because I connect. It also helps. I think that I mean, my son has a severe ADHD diagnosis and anxiety, and I think that helps a lot too because I can understand the struggles in school and outside of school. But the first thing I actually during eval, or if I had an eval the parent and they were coming to me for therapy, the first thing I always say to them is, this is not your fault. You could not have done anything during conception, during pregnancy, after pregnancy, during, raising your child. You have done nothing wrong. This is just something that has happened and made your child so unique and special, the way they are.
I like,
And usually the mom ends up crying,
yeah.
which, you know what, I love. It's bittersweet when you see a mom break down after you tell her that, because she's hurting, something is wrong with her child, but at the same time she's also crying because she's feeling relieved, because as a mom we do nothing but feel guilt, right? I
Yeah.
feel guilt all the time. So at least that's something that's a little bit of relief for the mom, that it's not your fault that this is happening. Now, I do turn that around once it's time to get started in therapy, etc., and go back to the strict thing, which is where I say, now is when it can be your fault. Which is, if you don't do what I'm telling you to do at home and do the carryover, that's when you've done an uh-oh. And then I can say, well, sorry. Because a lot of parents, also, if a child doesn't make progress, a lot of parents like to blame the SLP.
Oh, I know this.
Of course, you know this. We all know this. So it's not fair to us because we're doing what we're supposed to do by giving recommendations and telling them what to do at home. If they're not doing it, well, it's not our fault, but we still get in trouble.
Yeah, yeah. So what we try to do here, we try to be very honest at the beginning, like you are about that, and then just be more like, maybe this, and so you don't feel guilty, like, this might not be a good time for therapy.
Yep.
Come back in a year, or
Yep.
if you're not ready to do it right now. That's okay,
Yeah.
right?
It
Mom,
really is. Yes.
um,
I received a phone call for services about a month ago, maybe, and I told it was for sensory feeding, and I always tell the parents before I even meet the parent, we have a discussion about whether or not this is really going to work, because I there's so many, I would say, I hate using the word failures, but in things that can go wrong in feeding therapy if things aren't followed the way they should be followed. And that's why, like you said, sometimes it's not worth right now to do it. I told the mom how strict I am, etc. She was all for it. And then when I brought in the parents and the expectation of parents, she was like, oh, well, and then that's when she said, I don't think this is, and you know what? That is perfectly fine.
right.
No problem there at all.
I don't want to waste your time. You don't want to waste
Yep.
my time.
Yeah,
And then
exactly.
go do something fun with your kid. Like,
Yeah.
like
Hmm.
you're not worried right now. Like right now, my kid could be eating more things too. But I'm like, right now we've got so much going on. That's the least of my concerns. I
Yeah.
want to work on other things that, are good. Other things that we're working on. So, yeah, I totally get it, and I respect parents, and I think you do too. So great. Yeah, kind of
Absolutely.
advice, right? It's good
It's
advice.
hard. It's hard being a parent, especially a parent with a delay, a diagnosis. It's really hard. I get it.
Yeah, yeah, and I was looking at the next questions. Yeah, it is definitely hard, and I think the honesty is so important. Because okay, let's not trash talk anybody, but there are therapists who will see kids forever and make no progress and keep billing for them. Yes, I.
That was gonna be one of the things, because I believe eventually down the road you're gonna tell me what are some things you recommend that parents look out for, and that there are a lot of therapists who will keep a child that just is not making progress just to keep them to bill, which is completely immoral and not cool.
Yeah, it's not cool, and it's we don't want to waste your money. Don't come see
Nope.
us. Just we'll wait for you when you're ready because
Hmm.
we're not going to see your kid, and yeah, it's just sorry, but yes, that is definitely a huge thing. Don't continue to speak. If your child's not making progress, ask yourself why and have a discussion with a therapist because I'm sure they might just be not afraid to speak up. And I think, Jessica, you're one of those people who would speak up, and not all speech therapists are like that. So sometimes parents may be the ones that speak up, be like, hey, why aren't they making progress? And be willing to hear if it's both sides or not a good time too. What's one thing you wish every parent knew about supporting kids with communication challenges?
Oh, every single parent.
Just like an overall, I wish that everybody kind of knew this when their child's not communicating well. I wish they all would know.
Oh man. The patience, which is terrible because no one has, I don't have patience either. No, it's interesting because in everyday life I have patience. I mean, in everyday life with my own children, I don't have very much patience. But then I feel guilty because in therapy, I actually do very well and have a ton of patience, but that's my job.
Mhm.
So, but that's why it's difficult, I know, for parents not to have patience with a child with it's difficult not to have patience with a child with a speech delay.
Again, if the parent could know something about their
Right.
child that is a has communication needs or is late to talk, what is one thing you would want the parent to know at the beginning of
They're
your journey?
they're just as upset as you are. Parents are upset when they're or have a, it upsetting is a word that makes it seem worse than it actually is. What I mean is like a parent can be disappointed maybe. Like I said in the very beginning of the interview, a child knows when something's wrong with going on with them.
Mm-hmm.
Just because your child does not talk or your child is having difficulty talking does not mean they don't understand that you're disappointed as well. And sometimes it can be taken into context of them thinking that the parent is disappointed in them as opposed to being disappointed in the situation.
Right. Yeah.
Mm,
Like you're saying that
hmm.
kid, like you're upset, but so is your child. So
Basically, yeah,
they also are frustrated because they can't communicate with you either. They want to
right.
communicate with you as well. So
Yeah.
understanding
Hmm. Hmm.
that perspective. Yeah, I don't
Hmm.
know it that way, but yeah, you're right. Um, that's a good one. That's it's always a hard one. Now, let's say your mom and your speech therapist. So this is like kind of a good question to ask. I want to ask everybody. So three things you have a kid, just like
Uh-huh.
you need to do. Don't do this. Do this. Don't do this. What would be three things of advice you give? For an example, mine would be don't. One of mine would be like don't use a pacifier after 12 months. So like that would be one of mine. Where do you have like three things that you would tell parents do?
Yeah, but they're not gonna like them.
Okay, be your authentic self. That's what we're here for.
Get rid of the tablets. Get rid of them. I mean, there's such thing as moderation, but a tablet all the time, if your child is not communicating, well, a tablet is definitely contributing to the fact that your child is not communicating. I understand. Um, I gotta clean the house too. So guess what? The Nintendo Switch comes out sometimes when I want to clean the house, and that's okay. I'm not saying I'm a perfect parent because my kids don't own tablets, but overuse of a tablet is not okay. Electronics, I mean my kids have electronics as well. Watch TV, watch movies, but there's such thing as minimally and way too much. Especially kids that use tablets while they eat. That is a big no-no. You don't have your child, whether it's a food they do like or whether it's a food they don't like, you should not have a child watch any sort of tablet or TV while they were eating so they can focus on the food. Now, tablet use is a big one. What's another big one? Hmm. Bottle. Bottle is a difficult one because what age would you say bottle should end?
12 months?
12 months. Okay. So it was very difficult because they were persistent, insistent on their infant drinking from the bottle. But the thing is, the infant had just turned 1 years old. But they were very upset because I kept trying to focus more on solids as opposed to drinking from the bottle, and they were not happy. They
Is it
wanted the
the fear?
bottle.
Is it the fear they're gonna choke? Is that what that is?
No, I think that was just a culture thing.
Hmm.
Wait, you mean fear that they're going to choke on solids
Yeah.
or
Is that why they don't
no?
trans? I don't know. Okay.
No, they just wanted that bottle so badly. And honestly, if I wasn't working at this particular place, they were my patient when I was working elsewhere. I would have told them, "I'm sorry, then I'm not the right therapist for you," because that is an example of me having to keep someone on that's not going to see progress just to continue billing.
Right. No,
Hmm.
I appreciate it. But yeah, yeah. No, like definitely the bottle is it's a huge thing. And for you're also oral facial myofunctional, you're going to get really high narrow palate. You're going to sleep poorly. It's going to cause lots of issues. So
Right. Hmm.
any other something they should do, a proactive thing they should do.
Narrate. Now, it depends. What's the diagnosis?
Well, I think narrating is good for all kids at a young age, right?
Absolutely. But like when a parent comes in for eval, it's the first time we've met, no therapy is starting yet. Most of the time, the parent says, "So, what can I start doing right now?" And I always say, narrate. Because narrate can happen anywhere at any time. I always recommend the bathroom, the bathtub. I mean, I'd like parents to narrate all the time, but somewhere to really focus is in the bathtub because child most children love the bath and the child is confined to a specific area. It's really nice too narrating because it builds the parent child relationship as well because you kind of join in together like, okay, let's turn on the water. Okay, oh, that's too hot. Is that too hot? Should we go warmer? And that's how you can initiate the yes and the no. um People used to think I was crazy with my daughter and my son when they were infants because we'd go to Target and I'd put their little seat in and I'd talk to them like I was shopping with a friend. And we'd like, okay, what's next on the list? Okay, shampoo. All right, what type of shampoo are we going to get? I know you want the pink shampoo, but that's only because it's pink. We're not going to get pink. Let's see, what about this one? And then, oh, this one's nice. This one. So we kind of got communication going on in there. We got imitation. We got social skills. We got parent child relationship going on. And then there's either the people, other people in the store that think you're being ridiculous, or people that are laughing because they think it's just fabulous.
Yeah, and I love so narrating is pretty much talking to your kid, telling what you're doing,
Right.
which is fantastic. But what I think it does, and I think you nailed it on the head for every child, every parent in life, really, it's all about connection.
Yep.
And this forces you to connect, which is because we get busy in our phones, and we do this all the time. So we get busy, and so we don't connect with our children. And sometimes that's and when you connect with them by narrating and spending time with them and asking them questions, sometimes you start understanding them a little bit better, and their communication with you becomes easier because
Yep.
you're understanding each other. So that's I wouldn't have thought about that one, so I really love that advice that you gave because I don't think about narrating a lot. So. And that's simple. Basically, talk to your child. You tell them what you're doing, asking questions, everything, all the examples you gave. So that's awesome. Well, thanks so much for your time, Jessica. I was going to ask, tell us if a parent is trying to find you, what's the
Yep.
best way to find you? Where do you serve? What do you have a clinic? Do you go to daycare? Tell us all about your business. So if a parent needs to find you, they know where to go.
Okay, fabulous. I go into homes, daycares, schools. I am now in the public schools in regards to I've been approved by Pasco County, so I can go in as an independent contractor through
Wow.
2029. Yes, so
Wow, cool.
yeah, it's very nice. I'm located in the Trinity area.
Okay.
I'll go about 30 minutes from my main hub in whatever way. Land O'Lakes, I'm getting a lot of interest in Land O'Lakes, Nicole. But
Okay.
Land O'Lakes is very far from like everyone. Land O'Lakes is super far. But
Yeah.
Land O'Lakes, I get enough people call me and I'll make a whole day out of Land O'Lakes. But
Awesome.
I basically travel to you wherever you want me to go. I currently am a step up provider. So I definitely accept the scholarship. The scholarship accepts me. I currently do not accept insurance, but I will provide a super bill, which is like a receipt, which you can send to insurance for reimbursement.
And then they may pay or they may not. But that's just like us
Absolutely.
too. We build your people's insurance, and sometimes they pay and sometimes they don't.
Yep.
That's
Hmm.
how insurance works. And then is your website? What is your website?
Yes. My website is tweetlikeabird.com. You'll find my email on there, my phone. I have a Facebook, Tweet Like a Bird. It's a little out there because I'm a little out there as well. Like to be fun. And I don't have an Instagram yet, but I've been told I should have one because apparently that's for young parents nowadays too, is Instagram. Apparently Facebook isn't cool anymore, guys.
No.
What's up with that?
I know. I'm 41 and I'm like, Facebook groups. They're like, no, what? I think they, I don't know. Well, thank you again so much for your time. I will probably get this podcast out by next week, so I'll send you
Okay.
a edit before. And I just
Okay.
appreciate your time, and I'm excited about your business growing and you helping more kids in the area.
Thank you so much. Go ahead, call Tweet Like a Bird. Um, Follow me. That'd be awesome.
On
Cute
Facebook.
name. Yes, it's
Soon to be Instagram.
Tweet Like a Bird. Yes, on Facebook. No Instagram. It's a very easy name. Tweet Like a Bird. Super cute. Okay, guys?
Yeah.
Thank you so much, Nicole.
You're welcome. Have a great day. Thank you.